Welcome to NAT. My name is Paul Spanos, and today we have Harry Malos, the Clinical Counselor in Psychology, and the topic today is the ABC framework. Harry, welcome back to our program. And what is ABC framework? How we can make the viewers sort of understand that?
The ABC framework has been developed by a psychologist in the early 20th century, 21st century, and later on more developed by Albert Ellis. Mm-hmm. And although Albert Ellis developed what the ABC framework entails, mm-hmm. it has been borrowed mm-hmm. from Greek philosophy back in the 2,000 years ago, Stoic philosophy. Okay. And the premise of ABC is that the people are not disturbed by the event, which represent A, mm-hmm. but by the views in which they take the event. This is what the philosopher Epictetus said 2,000 years ago. And Albert Ellis borrowed that comment and developed his ABC framework, which we know in modern psychology today.
That means somehow when the event happens, it triggers something in me, and this is what is the important for my behavior, isn't it? Yeah. This is what determines my behavior.
That's right. The way we view it, the way we think about it, what we believe about the event is partly the consequence.
Okay.
So that's where we get ABC. A represents the activating event.
Okay.
B represents the behavior and the belief to the event.
Okay.
And C represents the consequences of such behavior and belief.
That means learning the ABC framework, it helps me to see my own behavior to the events that happens around me, isn't it?
Yes, it becomes you get an awareness of what's causing the consequences.
Okay.
So you know how it works. You know how the formula works.
So in this case, I can be more receptive and accept my own behavior.
Yes. Well, you have to understand your behavior.
Yes.
How it's influenced, and it's influenced by the way you think about it.
Yeah. Because for example, I can just walk into a supermarket or something, and then I see something in front of me, or I hear something, and all of a sudden my behavior becomes irrational for some reason.
That's right. That's right. And there's a nice little story which goes by two people viewing a great big wave in the ocean.
Okay.
One has not been familiar with waves and open ocean. Mm-hmm. The other is a surfer.
Yes.
Both people look at the event. One looks at it fearfully.
Yes.
The other one looks at it and sees only pleasure.
Okay.
But it's the same event viewed differently, which creates the consequence.
That's right. That means by understanding the framework, I understand better what triggers fears, anxieties, even depression.
Yeah, all of those things are helpful when we know that we're thinking about an event that occurred in a particular way.
Okay.
Yeah, and the saying that I have is that the greater tragedy in life is not what happens to you, but how you react to what happens to you. Yeah.
In other words, there is a cognitive thinking in our minds that collects things throughout our history or something, our story.
Yeah.
And then we react to events, and that reaction is very, very crucial. That's what the framework deals with.
Yes, and it's interesting that you mentioned, Paul, the cognitive side of it, because the ABC framework is a model that is used in CBT therapy, which is cognitive behavioural therapy. Okay. It's a tool that's used in that kind of therapy, where it challenges. In order for people to get better, it challenges how they view the events of the world and the experiences that they had.
In your experience with dealing with people in everyday life, how do you think this helps understanding their situation?
Well, it understands by understanding that it's not the event alone that causes us to feel sad. It causes us to feel anxious and fearful and reserved. It's not the event alone.
That means if I'm the one who reacts irrationally in such a condition, I usually blame the event initially, isn't it? Is that what you're telling me?
Well, how you view the event.
How I view the event.
How you view the event. That's what the ABC framework is. In the ABC framework, it suggests that A doesn't cause C. In other words, the activating event doesn't cause the consequences. Okay. It's B that causes the consequences, not A.
So the framework helps me to understand, to include my behavior to the event, not just the event in itself.
Yes, to consider your belief and your behavior, because that's ultimately what causes the consequence.
Because usually if I take my behavior out, I always blame the event for the consequences.
Or your belief, yes, correct. Remember the theory of the ocean and the waves?
Yes.
One sees it and believes as to be pleasure, the other sees nothing but fear.
Okay.
So is the event causing the consequences or what we think of it?
What we think of it, of course. Yes.
Yeah.
So, so the person who fears the waves, then, if it comes to you or to somebody for help, the framework is going to point what in his behavior?
It's
in his fears.
It's going to point out that what they think about the event, such as what it represents to them, is possibly a way to challenge their way of thinking in order not to create the consequences.
Possibly. I was just, I did have an experience with a big wave, to be honest with you.
Did you?
Yes, when I went to the ocean and I knew I was a good swimmer and I was, trying to play the hero, and all of a sudden the whole wave really turned me upside down and I was just about to drown myself.
Yeah.
And that created a lot of cautious next to me. Next time I'm going to see the big wave.
Yeah.
And I will never go into do surfing myself.
Yeah.
How this is going to, that means this framework is going to indicate to me what triggers my fears, isn't it?
Yeah, well, when you go to the ocean next time, you will see a wave and your thought pattern would be danger, danger, and that thought pattern will create the consequence of fear, not the actual wave itself again.
Very interesting. We'll come back in a few moments. Thank you for being with us. Stay with us. We're going to continue with this ABC framework talk. Welcome back to NAT. We continue with the topic of ABC framework, and with us we have the clinical counselor in psychology, Harry Malos. We did touch the definition of the ABC framework.
Yes.
And we can see that there's some triggers within us in relation to events that happens and the behavior that we have. How effective the ABC framework is, based on your experience, and if you have any example, how effective it is as a tool in your profession?
Yeah. Well, it is very effective because purely it's very simple. Okay. It isn't, a complicated theory. It is just 3 steps that occur that causes us to feel some kind of discomfort, some kind of disorder, and this continues. And this 3-step theory is a very, very simple way of looking why and how we are like that.
Okay. And just to help the audience to understand that is when they realize that they behave in a certain way on certain things, they can apply those principles on that framework.
Yes.
And understand better on this.
Yes. Well,
can I have an example of a story on this?
Sure, I can, without mentioning names, of course. When people start to challenge the way they view things, it has a huge impact on the consequences. And not so long ago, I was counselling a person who had a fear of flying.
Okay.
She looked at aeroplanes and perhaps have seen an accident in an airplane and was fearful of flying. And her whole life, she wasn't able. She was a business person. That's all I'll say, and she could not do her job because she was afraid of flying. The view of flying itself and the event of an aeroplane accident wasn't the actual cause to the consequences of her fearing flights. It was that in this particular person, he was a single parent, and had a young child, and the thought of something occurring to her with no one having to look after the child is what was creating the fear, not actually the accident of a plane. So it was the way she or he views it that caused the consequence.
That means the flying in this case triggers the danger.
Yes.
Or the potential danger. Or the way she
Not
thought.
necessarily. The way this person believed of the event allowed this person to feel that by going through with it, that there will be no one who will look after their young child. So the view of the event was the actual problem, not the event itself.
That means in this case, she connects the event with consequences of the child losing the carer.
That's right. That's exactly right. That's exactly right.
Okay.
Yeah.
And then, but the ABC framework helps me to understand that and see what triggers that danger and understand that there is more to the event. It's not only just that triggers the consequences.
Exactly.
Another consequences we're talking about is the consequences that I think of.
Yeah, the consequences are as a result of the way you think about it.
Okay.
It's if for example, if I'm at a football match, and in that football match I get injured,
Yes.
and I have a severe injury, next time I look at such an event playing football, I might look at it and say, I believe this event will cause me to have a broken leg. I believe this event will cause me to be in hospital. It's not the actual event, but you believe that you'll get hurt if you play again. And then we look at that and say, well, is that rational thinking? Is that kind of thinking helping you to live a normal life?
The way you said the example makes me think that the event and the belief system that I've got about the event exaggerates in a lot of different ways the consequences.
Yes. Exaggeration of the consequences of the event. Yes, definitely.
And that inflames my behavior even more.
Exactly. It actually, MRI scans have suggested that the way we believe of the event is actually more hurtful than the event occurring itself, because the way we believe and think about it is perpetual. It continues. It continues every day. And the event has just occurred once, but the way we think about the event, the way we believe about the event, continues every day. So it's replayed every day.
And that is that we can explain this way a lot of anxieties sometimes that they occur when we are parents towards the kids, and we are overprotective sometimes,
right? Or
we're not protective enough. That all depends, isn't it?
Yeah. So fear is usually fuels anxiety.
Yes.
It's what it fears that if I don't protect my child, something wrong will go. Something wrong will happen to it. So we become overprotective. It's how we view it that causes us to be protective.
Fearful. Yes, correct.
Right? So if we look at it and say they've got experiences of their own, they have to learn life as well, and me protecting them is not going to enable them to live a normal life. So we view it that way, we become less protective as the consequence.
Correct. And talking about that now, and that MRI test and the results really proves the statement that you mentioned in the previous
That's right.
segment. Can you read it again, and we close this segment and we go to the third part?
Yeah, well, Epictetus, I'm not going to repeat it exactly how he said it, maybe I'll be quick enough. And he said, people are disturbed not by the event. He said that over 2,000 years ago. People are not disturbed by the event, but by the views in which they take the event. I thought that is a very philosophical and...
but it's a reality though. It is
very
a
much
reality,
so.
proven though.
Yeah.
Harry, thank you. Please stay with us for the third segment. Thank you for being with us. We're going to continue shortly. Welcome back to NAT, and we continue with the subject ABC framework with Harry Malos, the clinical counselor in psychology. Harry, we continue on the same subject, and how, when I realize that I need to know more about myself, how this ABC framework can benefit my own mind thinking different about the events that are happening around me.
Yeah, well, how, I guess you're asking how the ABC framework works in order to change the consequences.
That is correct.
Because after all, we're talking about the consequences.
Yes.
And as we covered earlier, the event alone, or the event is not so much the cause of the consequences as much as how we view the event and believe about the event. So, and the consequences can be healthy or unhealthy. If we view it in a healthy way, then the consequences will be healthy. But in my line of work, it's generally that we view it in an unhealthy way, and the consequences are negative.
Okay.
So now I guess the essence of your question is, how do we use this framework to actually have healthy consequences?
Okay. Now, in this, do you touch my behavior?
We talk about your belief.
Okay.
We talk about your cognition of the event. We talk about, has your thinking about this event contributed to you feeling fearful or to you feeling anxious?
Because as you said before, my belief system really contributes to my behavior, isn't
That's
it?
right. That's right.
So you're touching those things that contribute to my behavioral pattern.
Exactly. So we would the way we would do it is this: has the way you think about it, has it helped you?
That means can I okay, then in this case, can I change those triggers?
Absolutely. And the theory goes that if you have thought about it in a way that has produced unhealthy, negative emotions, we intervene on our thinking. We intervene, we dispute. We say, what evidence do I have that suggests that my way of thinking is going to be the result?
That means you challenge my own belief system that was based on so far.
Yeah, it's exactly what that is. We challenge your belief system. And we don't challenge it without any cause. We challenge it with evidence. We say it is all evidence-based. We don't just say, well, don't think that way because, it's not healthy. The alternative is evidence-based. We ask, what's the evidence? We challenge the irrational thought. We challenge the irrational belief. And if we do that, it creates a different emotional effect. And the emotional effect would be of a positive one from a negative one in relation to thinking.
That means in this case, next time I see the same event, I do not have only one trigger. I've got the second, because you explained to me, for example, what triggers my behavior, and you challenge my belief system. So, but you give me an alternative to my belief system that can help me to see alternative thinking, and then I behave differently.
It's exactly right. We dispute it. We say, now that we've realised that when you think or believe that way, it creates fear, it creates anxiety. So we know that that kind of belief isn't healthy. Now, how do we change that belief? How do we make it so that the consequence is of positive? So we say, okay, what evidence do you have? We dispute the thinking process that creates the negative emotion. We dispute it with evidence. We say, well, when you think of that, does it necessarily mean that that's what happens?
That's it.
Yeah, and that's evidence-based. You know, for people of fear of flying, for example, you would say that statistics show that flying is even safer than driving a car.
That's right.
So when we think of flying, that it is safer than driving a car, guess what happens to our fear, which is the consequence? It's reduced.
Exactly. Because I've got an alternative to my first thinking, my initial thinking that creates fear.
That's
I've got a reason to think.
Based on evidence.
Based on evidence.
Yes.
That's right.
Yes.
So, then the ABC framework in this case works as a tool to realize what triggers my initial behavior, but at the same time gives me the opportunity to accept another belief system or reality that I never have accepted at that moment.
Yes. We don't think about it that way, because if we thought about it in a positive way, we wouldn't be in a position to seek help. We wouldn't. If we look at an event in a positive way, the emotions would be healthy.
Yes. Correct.
And you wouldn't go to someone because you're in a great state of mind or because you're happy. Or you would go there if your whole life is governed by fear, and you cannot socialise, you cannot sleep, you cannot eat. So they are negative consequences.
Does this theory, and we're going to close possibly with that, does this theory helps people with vulnerabilities?
People with vulnerabilities, I'm not quite sure.
Aged people.
Yep.
Because they don't have enough understanding, and they understand their own belief system, but you have the new generation coming up.
Yeah.
And they take over.
Yeah.
They have the authority now.
Sure. Well, we can look at, and I've worked with aged care people in the past, and a lot of their belief system is that the life now is over for them, that they're not important, that they lost their autonomy, that they lost any power of themselves. So again, we would kind of challenge that kind of thinking.
Okay.
We would say, but you have achieved so much. Yes. You're a success story because you've got so much that is proven that you've achieved. You have a lot of wisdom. You have a lot of experience. When you start thinking of age in that way, guess what happens about how you feel about yourself?
That's right. Yeah. And thank you for discussing this topic with us today, and thank you for being with us, because this way you support not only the community TV, but community TV is really the communication between the experts to the audience.
Yes.
And the audience, they have the opportunity to find out a lot of things, and in a simple way. Thank you for being with us, and thank you for your support. And we're going to call you again.
Thanks, Paul.
And to the audience, we did have an interesting topic today. Stay with us next week, the same time, for another interesting topic.